In our previous video we gave you a thorough analysis of injuries associated with infant rape using a recorded rape video of a 9-month-old male. Today, we shall be talking about 12 things you need to do after rape to ensure you bounce back to a stable emotional status and in good time. We encourage you to see our previous video titled, Mindless Rape of a 9-Month-Old Baby, Analysis of Injuries. Remember to subscribe to our channel to get regular feeds, share, like and comment to enable us serve you better. Watch to the end. The most difficult aspects of rape is dealing with the after effects. In almost all the cases, the victim lapses into a period of psychological trauma which includes disruptions to normal physical, emotional, cognitive, and interpersonal behavior, a condition described as rape trauma syndrome. The duration varies amongst individuals from days to years. However, this video will give you 12 things you must do as a victim for quick recovery. 1. Get to a safe place. Because most cases of rape occur in isolated environment that may further endanger your life, it is very important that the victim immediately moves to a more secure environment after an attack. A prolonged stay at the scene may further predispose one to another attacks. 2. Tell someone what has happened. Most people think that if they don't talk about their rape experience then it didn't really happen. They therefore continue to live in denial. But the point is, you can't heal when you're avoiding the truth. And hiding only adds to feelings of guilt and shame. As scary as it may be to open up, it's what will set you free. However, it's important to be selective about who you tell, especially at first. Your best bet is someone who will be supportive, empathetic, and calm. If you don't have someone you trust, talk to a therapist or call a rape crisis hotline. 3. Preserve every evidence of the rape. Almost every rape victim's first response will be to clean up as quickly as possible. However, this is not advisable. If you do, you run the risk of washing away all physical evidence of the rape, so do not be in a hurry to bath, shower or wash your clothes. Doing this would get rid of blood, semen, saliva or hair that could be used as evidence of the rape. If you are injured, go straight to your nearest hospital or doctor. If you can, take photographs of the site, your body if possible the perpetrator. That way it will be easy to pursue a legal course. 4. Decide whether you want to report the rape. The decision to report a rape case may not be easy to make. Consequently, you do not have to decide immediately whether to report the rape to the police, but the sooner a doctor examines you, the more likely they are to find physical evidence that they can link to the rapist. If you decide to report the rape, then a visit to your nearest police station will be necessary. There, the officers will take your statement. The police will take you to a health center where you will receive medical attention and undergo a forensic examination. If you do not report the rape, you can go directly to a health center to get these services. 5. Visit a hospital. This is very important for a forensic examination and prophylaxis against sexually transmitted infections and unwanted pregnancy. Your health provider will give you medicine to prevent unwanted pregnancies, HIV and sexually transmitted infections, STIs. After the forensic examination, the doctor will give you the morning after pill to prevent pregnancy and antibiotics to prevent possible STIs. You will also be given an HIV test, and if it is negative you will be given antiretroviral treatment for 28 days to prevent contracting HIV. This is called post-exposure prophylaxis PEP. 6. Challenge your sense of helplessness and isolation. Sexual assault can be very traumatic that it leaves you feeling powerless and vulnerable for days. It's important you constantly remind yourself that you have strength and skills that enables you cope and get you through the trauma. One of the best ways to reclaim your sense of power is by helping others, volunteer your time, reach out to people in need, or donate to your favorite charity. 7. Join a support group. Joining a support group is highly recommended. The group will help you feel less isolated and alone. They will also provide information on how you can cope with symptoms and work towards recovery. 8. Prepare for flashbacks and upsetting memories. Traumatic experiences such as rape can cause our nervous systems to become stuck in a state of high alert. We become hypersensitive to the smallest of stimuli. This is the case for flashbacks, nightmares, and intrusive memories are extremely common, especially in the first few months following the assault. Try to anticipate and prepare for triggers. Common triggers include anniversary dates, people or places associated with the rape, and certain sights, sounds, or smells. 9. Reconnect to your body and feelings. In many ways, rape makes your body the enemy. You view it as something that's been violated and contaminated, something you may hate or want to ignore. Although the process of reconnecting may feel scary, it's not in any way dangerous. Once you're back in touch with your body and feelings, you will feel more safe, confident, and powerful. 10. Stay connected to family and friends. It's important to stay connected to life and the people who care about you. Having fun and laughing with people who care about you can be equally healing. 11. Avoid alcohol and drugs. As much as possible, avoid the temptation of alcoholism and substance abuse. Drug use worsens many symptoms of trauma, including emotional numbing, social isolation, anger, and depression. It interferes with treatment and can create relationship and other domestic problems. 12. Participate in social activities. Reconnect with old friends, make new friends. If you're having trouble relaxing, you may benefit from relaxation techniques such as meditation and yoga. Don't forget to like, comment, and share this video.